Hello and good evening, everyone. My name is Choudhary, and I welcome you all on behalf of Voice of Healthcare and thank you all for joining for the panel discussion on Head On Against Head and Neck Cancer, organized by Voice of Healthcare and supported by Merck. April is observed as the Head and Neck Cancer Awareness Month. To raise the awareness on we are gathered on this panel discussion. And the panel discussion will cover topics ranging from identification and differentiation of cancer structure to symptoms, prevalence, and causative factors in India. Discussion will also explore lifestyle and demographic disparities, treatment advancement, rehabilitation needs, risk reduction strategies, and the role of community based organization in raising awareness and educative preventive measures. Throughout, emphasis will be placed on incorporating recent research advancements and innovative approaches to improve diagnostics, treatment, and patient outcomes. Now, I would like to welcome our esteemed speakers for the day for the panel discussion. Dr. Prasad E, Senior Consultant Medical Oncology, Apollo Proton Cancer Center, Chennai. Welcome, Doctor.
Namaste.
Colonel Ajay Tomar, retired, CEO, Indian Cancer Society, Delhi branch. Good evening, Doctor. Good evening, Colonel. Miss Vandana Mahajan, PGDIC, Palliative Care Counselor, Cancer Counselor, Patient Advocate, and also Cancer Survivor, Noida. Good evening, Miss Vandana Mahajan.
Good evening to you. Thank you.
Dr. R.K. Choudhary, Director and Head Medical Oncology, Haemato Oncology, BMT, Metro Hospital and Cancer Institute, Delhi, and Metro Multi Speciality Hospital, Noida. Sir will be joining us in a minute. I welcome you all and thank you all for joining and taking out time for us and raising the awareness on head on against neck and cancer treatment awareness. I cannot wait more to start this insightful discussion and get to know as much as expertise and insights on this important topic. So I would like to ask my first question to Dr. Prasad. So I would like to know, can you please explain what head and neck cancer entails and how prevalent it is in India? And what are the main types of head and neck cancer right now?
So, thank you so much, Shekhar. So, thanks for the opportunity. So, answering your question, the basic cause for head and neck cancer, at least in our country, is tobacco. We are the tobacco capital of the world. We have different forms of tobacco, smokeless, but at some point of time, all the teenagers or the elderly age group over a period of time get addicted to this tobacco at some point of time. And when this addiction goes on for a longer period of time, it becomes a habit, and over a period of time, this habit turns into different health issues. The most common health issue, which is of a very serious concern, is cancer. So, tobacco exposure is the major reason for developing head and neck cancers, at least in our country. The second thing is alcohol. Alcohol, again, it is a very serious issue, which again catches up much more in the society. Initially, when I was in, I had to, I was going to a hotel which was not having the bar, but now it's all like family restaurant with bar. There's a lot of change in the society. People have changed, mindsets have changed. So when an youngster goes to, or a child goes to the hotel just for having food, they get to see that consuming alcohol, or at least that becomes a norm for them. It doesn't sound different when they get to hear the word alcohol, or when they get to see people happily having this in a common place. So over a period of time, we are socializing dangerous habits as a routine in our regular life, and probably that affects our next generation. So overall, we need to make sure that we need to cultivate healthy habits in the next generation, so that the future India is all safe.
Great, sir. Thank you so much for putting that a light on that. And that is for sure by the, I believe, all these a little bit of health disease, lifestyle diseases, which we all are seeing, like how our habits are changing and stuff like that. But if I have to ask about Miss Vandana Mahajan, my next question would be to you. As a cancer counselor and palliative care counselor, could you share some insights into the emotional and psychological challenges faced by a cancer patient, and how do you help them to come up with that, and what are the strategies you use on this?
Thank you, Simran, for asking that very, very important question. I want to congratulate, Voice of Healthcare for including the impact a cancer diagnosis has on the emotional health of a person. So I'll start by saying that when we talk of cancer, we have to remember that it not only affects us physically, it impacts us emotionally also, which a lot of times is not really paid too much heed to. So let me also, first talk about palliative care. There's a huge misconception that palliative care is associated with end of life care. It is not so. So when we talk of psychosocial support, it is an integral part of palliative care. So palliative care basically, it's a multidisciplinary team working together to provide total relief from total pain to a person. So when we speak of total pain, it is physical pain which is caused by the disease. It is social distress because of various factors. It is financial distress. It is spiritual distress. It is existential distress. So it is very, very important that whenever there's a cancer diagnosis, it doesn't matter whether it's a head and neck or a breast, right at the time of diagnosis, we integrate palliative care with the treatment plan, which is very, very important. And it doesn't happen in our country, Simran. Sadly, it doesn't. So now let me just shift the focus to emotional distress. In case of cancer, it could be any cancer. The first thought that a person gets is, why me? So the next is the fear. The word cancer has so much fear because of the stigma attached to it, the myths attached to it, that the person automatically assumes the worst. Fear. So along with the fear comes anxiety. Then follows depression. Then follows a future that the person is does not know. So it is uncertainty which is there. Then comes in, like for example, when we talk of specifically head and neck cancers, there is guilt. Now people who consume tobacco or have alcohol, while they're doing it, they don't realize what they're doing, right? But when they get diagnosed with something like cancer, a huge guilt feeling sets in. The guilt is, because of me, my family is going through a lot of problem. I am the cause of trouble. I am causing financial drain. I become a burden to my family.
Yeah.
So that guilt is also very, very huge. And then there is denial, and then there is, the fear of death. So when I talk specifically of head and neck cancers, it's a very complex cancer, and the doctors here would agree with me, because with a head and neck cancer, it doesn't matter whether the intent is palliative or the intent is curative. It is going to bring in a lot of morbidities. For example, now when someone has tongue cancer, a part of the tongue is removed, which will impair that person's speech. Now, if somebody has a buccal mucosa cancer, maybe a part of their jaw is resected. So there is permanent disfigurement, right? So then, there are some people who have a nasogastric tube attached. For as long as they're alive, they have to be fed through that. Along with that, so this is again focused specifically on head and neck cancers. They lose their speech. A lot of speech impairment is there. They have difficulty in swallowing. So the quality of life is tremendously compromised. It becomes very important to address all these issues. Also, when I talk of disfigurement, so I'm just going to cite an example, which is again very common, Simran. Uh, Now, suppose it's a couple. Now, there is disfigurement. I have handled cases where the wife does not want to go near the husband because he looks a certain way. There is, if he has a fistula, that's another problem. He's drooling, he looks unattractive. So there is, the sexual intimacy is also affected, and it is it's vice versa also, Simran. The suppose one of the partners has undergone something like this, they presume they are going to look unattractive, they don't fit into the system, there are body image issues, and they get withdrawn and move into a shell. And this affects them in a big way. So therefore, it becomes very, very important that a counselor who's trained in this, in cancer counseling, is onboarded. And it is a challenge. Head and neck cancers are a huge challenge. To help them find meaning in their life, to help them find a purpose, is not easy. So it's an ongoing process. Therefore, it's very, very important that right at the time of diagnosis, the oncologist brings in a counselor on team, because in along with the counselor there has to be an MDT, a multidisciplinary team, like a speech therapist, somebody who can help them swallow, somebody who can, if they have undergone radiation, they need a physiotherapist, because it's not easy. So it's a team effort. Only then can we say that we are able to support them. And again, I'm going to emphasize head and neck cancers are difficult and complex cancers. And we need a lot of support, we need a lot of empathy and compassion, not only for the person diagnosed, but also for their family. Plus the financial drain, the financial toxicity, the time toxicity that comes in, all together makes it an extremely difficult journey. So, psychosocial support is extremely important.
You said it right, ma'am. Head and neck cancers are very complex. It affects your personal life. It affects you emotionally and financially. It makes you terrible, feel terrible that okay, I'm not looking good, I'm this and that, and any kind of cancer can make you feel that, can make you feel low. Something is going to be missing, or something there is. Why me? The kind of feeling, why me, why I'm there in this condition. And it not only affects the person but the people attached to them. And you said it right, at that point of time when the person is diagnosed with the cancer, the oncologist should introduce the counselor to them, because it will not only help the doctors but also will make the process a little bit easier, to make them realize okay, the process is going on. Mentally and emotionally they will be feeling a little stable better because of the regular and consistent counseling the counselor is giving them. So that way both the things are going hand in hand, and things, the patient will respond in a better way when the person is in a better mental condition to receive treatments, to receive what's going on, and to accept the fact, yes, I'll be fine, I'll be okay, everything is going fine, and we all are working for the good direction.
Absolutely, Simran. And also, it's very important to reinstate the self worth of a person. If that can be done with the help of a counselor, the compliance will be far more. A lot of times they give up. हमने तो नहीं करना बिकॉज अब तो हमारी लाइफ ऐसे ही हो गई है. So the compliance towards treatment is also, there's not compliance in the treatment. So if the self-worth is restored or supported, the compliance will be far better. Thank you.
Thank you so much, ma'am, for sharing your expertise on this. My next question would be to Dr. Chaudhary. Uh, Good evening and welcome, sir, to the session. Sir, you're on mute. So my question would be to you, what exactly are the common signs and symptoms of the head and neck cancer? And if we talk about the predominant risk and factors of head and neck cancer, what are those? And additionally, is there any gender specification towards this type of cancer? And if it is, then why? Why does it, is it, specifically about one gender, or typical to one uh, female or male?
Thank you, Simran, for having me here, and thank you so much for choosing this topic, head and neck cancer. This is a very important topic, and head and neck cancer being the one of the most common cancer in India, this is very pertinent to discuss this topic. And before I come to your question, I would like to make few comments on the what Vandana Mahajan ma'am told. She rightly uh, told the story of the patient of head and neck cancer, specifically any cancer. So I differ on few points that she painted this picture of head and neck cancer very gloomy. And let me tell you, and my oncologist will agree on this, that nowadays the picture is not like that. The scenario is changing fast. People are now coming to the terms and accepting the things. Now, cancer as a word is like a very dangerous word. But nowadays, people are accepting the things. More and more cases are being diagnosed. People are getting more aware. And let me tell you that cancer is just another type of disease. So any disease in your body is going to create some kind of problem. So we need to accept this. And cancer per se need to be looked at as a type of another disease. Maybe it's diabetes or hypertension or any other disease. So normally cancer we divide into the early stages and the advanced stages. And if you talk about the early stages cancer, they are much better than any chronic diseases. For the simple reason, they are the diseases which can be cured. And there are many diseases where people are suffering like diabetes, hypertension, hyperthyroidism, or chronic kidney disease. They remain with you for lifelong, and not the early stages cancers, right? And the all depends on the first consultation with the doctor, how you counsel your patient. And it rightly man said that it is very important to bring the counselor from the first visit itself, so that the patient's acceptance become easier once the counselor comes into the picture, right? Now coming to the head and neck cancer, why it is important to discuss, because this is one of the most common type of cancer in Indian. And coming to the etiology, then use of tobacco is the most common cause of head and neck cancer, whether it is in the form of BD or cigarettes or any other form of the tobacco use. Whether different areas there are different forms of use, like some use in the tobacco forms, tobacco in the gutka forms, or any BDs and cigarettes. So they are the most common cause. Apart from the tobacco, the other causes are like alcohol consumption is also one of the important factor. Then HPV infection is responsible for many cases of head and neck cancer. And when we talk about the etiology of head and neck cancer, or for that matter any cancer, we divide these cancers in causing agents into two things or two categories. One are the causes which are under control, like lifestyle, smoking. And there are other etiologies which are not under our control, like environmental factors, like genetics. So the genetics also plays a role in the cancers. In head and neck, it is very small, but still they plays some role, right? And what was your second question, please? Can you repeat, please?
So my question to you was the common symptoms and predominant risk factors for head and neck cancer, and is there any gender specification of this type of cancer?
Right. So common symptom, like when we talk about the head and neck cancers, we divide these cancers into the various parts depending on the site of origin, whether it is coming from the lips or from the buccal mucosa or coming from the throat, like pharyngeal carcinomas are there, laryngeal carcinomas are there, buccal mucosa cancers are there, cancer tongue are there, paranasal sinus cancers are there, then salivary gland cancers are there. So depending on the site of origins. So again, the symptoms and the signs also depend the site of origins. Like if the most common symptom of the head and neck cancer are the non-healing ulcers. So if it is lip cancer, then non-healing ulcer will be there on the lip. If mouth cancer is there, then that will be coming from the buccal mucosa or the tongue. And depending on the locations, like pharyngeal carcinomas or the laryngeal carcinoma will have the hoarse voice, then there might be the difficulty in the degglutination. Swallowing might become the difficult. Then if the cancers progresses in the with the time, then they might spread to the neck, then lymph node might be there. So swelling in the neck might be the another symptom and sign. So even if their issues are not addressed at the proper time, they might go to the other parts of the body where we call metastatic diseases, and that might create the or produce the systemic symptoms like the decrease in the weight, weakness, generalized fatigue, a poor appetite, and the depending on the part involved. If the liver is involved, they have symptoms related to liver. If the bones are involved, the symptoms related to bones, bony pain might be there. If the lungs are involved, the symptoms related to lung might be there. There is no specific gender specific uh, inclination is there, but since the males are more tobacco users, so it is commonly more commonly seen in the males, but there is no gender specific like inclination for the head and neck cancers.
Thank you, sir. Thank you so much for sharing your views on this and shedding light on what are the main signs and symptoms and how it can be diagnosed. And is there any gender specification? You said it right, because maximum users or consumers of alcohol or tobacco in our country we can see are males, and that's why it can cause to more of the males as compared to females in our country. Coming to you, Dr. Chaudhary, I want to know more about you, from about how typically it can be diagnosed. The head and neck, how can we typically diagnose the head and neck cancer? And could you also shed light on the different stages of these diseases and the potential to spread on the other organs, and how fast does it spread?
Right? When we talk, whenever a patient of the head and neck cancer comes to us, like suspected cases, so there are typical set of investigation that we require to carry on. So the various investigation, apart from the routine blood test like biochemistry and hemogram, we would like to do the endoscopies like laryngeal endoscopies or nasal endoscopy depending on the symptoms. Then we need to find out the what is the site of disease, what is the extent of the disease. For that we need a imaging tests, imaging in the form of maybe the x-rays, maybe the CT scan, or maybe the MRI, and maybe the whole body PET scan. Then, to confirm the diagnosis, we need to take biopsies. So, biopsy can be taken from the neck node, or depending on the ulcer, if they are visible from the tongue or the buccal mucosa, or they are deep inside the throat, then through the endoscopy guided biopsies are taken and they are sent to pathology for the histopathological examination. So, this is the biopsy which confirms the diagnosis, as with the any other site of the malignancy in the body, right? And for the staging purposes we need this all the imaging things. So any cancer, like in the other parts of the body, head and neck cancer also grows with the time. If you don't pay the attention, with the time they slowly grow and involve the other parts of the body. The first site of metastasis is the neck node. If they are not taken care at that moment, then they'll go to the other parts of body, most likely the lungs or maybe the bones, and depending on the type of the cancer, they might go to involve the other parts like the abdomen or the liver or any other part of the body, right? So coming to the stage, so there are various systems of staging. Normally we use the TNM staging. So as per the As the size increases, the stage for the general population, if it is a localized disease, then it is stage 1 or 2. If it has spread to the lymph nodes, most likely it is stage 3. And if it has gone beyond the neck to involve the other part of the body, it is most likely stage 4. For comprehensive and for medical purposes staging, there's a extensive staging system. But for the public perspective, it is a early stage, locally advanced stage, and a metastatic stage. Also, staging system is pertinent for the use of or the planning of the treatment. Different stages are treated differently depending on what is the condition of the patient, what are the symptoms, and what is the stage.
Thank you, sir. Thanks a lot for letting us know about this. And so, my next question would be to Dr. Prasad. So, can you please tell us about what are the standard treatment approaches for head and neck cancer, and what objectives do these treatment aims to achieve? Right, and also, is there surgical intervention necessary for all the patients or for all the stages of head and neck cancer diagnosed with? And if even if the patient has been removed with the cancer, how frequently does this type of cancer reoccur?
Yeah, sure. So just allow me a few moments to have a detailed description of how we need to go about approaching a cancer and how what are we going to do when a patient comes to symptoms of cancer. So I just add on to what Dr. Choudhary had said. Gender disposition, yes. Initially, cancer is not like somebody who had this problem 3 days ago and the fourth day or the next week that somebody had developed cancer. It's a disease because of the lifestyle habit. So in India, head and neck cancer wise, predominantly it is because of the habit and the addiction specifically. Initially, 20 years ago, we were seeing more of the males looking at the use of tobacco and smoking. 20 years back, it was more of males, and now we have a lot of male cancer patients coming onto the hospital with head and neck cancer. The trend is changing. Any metropolitan cities, we could always look at equal amount of population, both men and women, young women especially, having cigars, going to the pubs, consuming alcohol, getting exposed to all the unnecessary addictive substances. So this is the bud. Maybe another 20 years later, we might probably see equal gender predisposition. We might be looking at more men as well as women coming on with similar types of habits. Probably different parts of the body based on the exposure. So, first thing that needs to be curbed, awareness has to be created both in young women and young women to stop this addictive habit. Number one. Number two, always prevention is better than cure. So before entering into the treatment aspects, I would always urge to have the help of the psycho counselors, the de-addiction centers. Simple. Awareness starts from school and college. Make sure that these are all unnecessary habits and this needs to be prevented. When somebody have this habit for a longer period of time, probably they might need to be properly counseled to make sure that they visit a clinician, a doctor nearby their home for a proper checkup, and they have to quit the addictive habit. For example, somebody choose a tobacco. The person might be keeping it in the mouth or under the tongue, wherever it is. Whenever there is a change in the feel of that particular area, probably that area might become a little hard, or they might have to when they spit, that saliva might have a little bit of blood, or when there is a growth, when the person is not able to eat properly or chew the food properly, or when there is pain. And Dr. Chaudhary had clearly said cancers, when they start to spread, it spreads to the neck nodes. Nature had provided us a lot of natural barriers in the form of lymph nodes. So when there is a cancer, when an inaccessible site, or probably before they are big enough to produce symptoms, the lymph nodes would be the first place where the patient would come to the hospital. At least in our country, we have options of lymph node being tuberculosis or any other infection versus a cancer. So a doctor should be the right person who needs to be approached whenever a person has a problem, any health issue. They shouldn't go to a medical shop, just get a painkiller or some other antibiotics or some medication straight from the pharmacy. That's a very wrong behavior, and probably we do not have anything to control such things. Nowhere in the world anybody can get a over the counter prescription for antibiotics except in India. Whoever goes to a pharmacy with history of fever or anything, the pharmacist will give white may goli, red may goli, green may goli for 7 days, 5 days, what is that has to be stopped. So a doctor should be the right person who would be able to diagnose what the problem is based on the symptoms and guide them appropriately to the right place. Head and neck cancer is one disease where the first hit is the best hit. At least in the other cancers, we do have first line, second line treatments where we have better chances of a long term disease control even in advanced stages. But till now, though we have a lot of treatment advances in head and neck cancer, we do not have a chance of even a long term disease control when the disease recurs. First hit is always, always, always the best hit, and catch the cancer when it is small, when it is early, when it is curable. We cannot discuss about a cure, especially in a head and neck cancer patients, if it is an advanced stage. So, coming to the screening, we might not have a regular screening in our country, especially for the head and neck cancers, but prevention is always better than cure. Second thing, somebody who has any symptoms, like what our my colleague Choudhary had said, uh, patient needs to visit a doctor. Coming to the treatment part of it, generally cancer treatment is classified into surgical treatments, chemotherapeutic or other systemic treatments, and the radiation therapy. So, when we are specifically looking at the treatment approaches in head and neck cancer, we classify based on the early stage, an advanced stage, or a metastatic stage. Advanced stage can be otherwise classified as loco-regional. Ms. Vandana had clearly said emotional distress, psychosocial, mental, physical, disfigurement, everything is part of the head and neck cancer treatment. If the patient is caught in a very early stage, there is absolutely no need to have to undergo extensive surgeries, long time of treatments, different specialists involved in treating one page cancer patients. If it is an early stage, it can be easily amenable for a small surgical procedure called a wide local excision. And we do have certain procedure surgical techniques which are the standard, but early stage oral cavity cancers, that's in the front of the mouth, so that part is called an oral cavity. So when somebody comes to a clinician with the early stage oral cavity cancer, a wide local excision or a simple surgical removal of the suspicious or the involved site would be a curative procedure, number one. If the disease is probably say in the throat, the part which is behind the tongue, so that's called as oropharyngeal part or in the voice box. We don't have to excise the lesion. Radiation therapy alone is curative in early stages. If it's going to be a little more advanced, say for example the disease is there in the mouth or head and neck area, and the lymph nodes are involved, so that part of the lymph node, if it is involved, we need to see how many levels are involved. So all these put together, we do have a staging. We do the investigations like CT scan, MRI. If access is available to a whole body PET CT scan, we do that. There are newer techniques that what we do in Apollo Proton Cancer Center. We do have something called a FAPI PET CT scan, trihexene PET CT scan. So all these are all advanced PET CT scans that what we have in Chennai. So based on that, we can identify different stages of cancer, even if the cancer recurs. So based on that, we would devise the treatment plan. So if it is a loco-regional treatment, for example, the patient has a tongue lesion and some neck nodes in the body, that is called as a loco-regional treatment. So the tumor board decides the treatment. It's not a one person's decision. It's always the tumor board, which involves the doctors, nutritionists, speech therapists, counselors, psychologists, The whole team sits and decides the treatment plan for head and neck cancer patient or for any cancer patient. That should be the norm. So if it is a loco-regional disease, the treatment is a multimodality. For example, if it is an operable, the patient undergoes surgery, and after recovering from the surgical procedure, the patient needs to be planned for radiation therapy with or without chemotherapy. So that is something which has been age-old treatment, and that gives say around 60% of cure. But there's a lot of newer things coming up. There are a lot of newer advances. Every time we know head and neck cancer surgical treatments have a lot of difficulties, comorbidities, disfigurement, social acceptance and acceptance issues. So there are now newer options like neoadjuvant immunotherapy. That means the tumor is shrunk to a smaller operable size by giving immunotherapies, by giving systemic chemotherapies, targeted therapies that shrinks the tumor and reduces the volume of surgery, makes the life for the patient much more easier. We don't have to have a big scar on the patient's face. There's no need to keep a big flap in the patient's jaw. Times are changing. There are newer surgical techniques which are being coming up. Robotic surgeries, transoral robotic surgeries, TORS. That's something which is being coming up in the surgical specialties as such. In the field of medical oncology, which I practice, immunotherapy is coming up. When we are looking at specifically the head and neck cancers, the head and neck cancers mainly because of tobacco or smoking. Smoking induces a lot of antigen exposure in the body. So that antigen, which is called as a tumor antigen, tumor-associated antigen, is a target for immunotherapy. So when we give immunotherapy prior to surgery, the tumor shrinks, and when tumor shrinks, the scope of surgery from a major surgery is restricted only to a wide local excision without major surgical time for recovery or major disfigurement. Then subsequently, patient can be planned for radiation therapy with or without chemotherapy. The major problem comes only when we have a stage 4 very advanced head and neck cancer patients where the disease had started from one part of the body and has gone to say, for example, lungs or the mediastinum of the bone after surgery or after any other prior treatment. So that is an advanced stage where it's very difficult for any clinician because the survival is very poor. But for a head and neck cancer, stage 4 is very, very, very limited. Most of the patients in India come in the local regional setup. So it's the team where the patient approaches, where the patient is getting treatment, takes up the responsibility of having a tumor board, starting on with the appropriate treatment, probably incorporating the newer forms of treatment. You should not always kind of look back, practice the old treatment. We should think out of the box. We need to have a lot of newer innovative strategies to treat such patients to make sure cure is the only objective in head and neck cancer patients. We can achieve cure. Yes, it is possible, provided we do have a collective approach to a problem where we can sit together, use different modalities of surgery, radiation, chemo, targeted therapy, and there are immunotherapies which are now coming up in India. Though expensive, we are now looking at a lot of newer drugs which are going to be much cheaper, and probably by the end of this year, we might be having a lot more immunotherapy drugs, which should be affordable, which would give a long-term disease control, and patients would definitely be able to have a longer disease control. Or probably, I would still say the cure is not far in head and neck cancers.
Said it right, sir. Cure is not far in head and neck cancer because I believe all those lifestyle habits, diseases which we get because of lifestyle changes and habits that can be cured if we cure our lifestyle and change accordingly. Because a healthy lifestyle will never give us any kind of disease, right? And you have explained everything very well from the stages to the operations to the diagnosis and how it can be cured and things very well. So thank you so much for shedding light on that thing. My next question would be to Colonel Ajay Tumar, sir. Sir, as the CEO of the Indian Cancer Society's Delhi branch, can you shed light on the role of NGOs and multilateral organizations in raising awareness about the various types of cancer? How are the NGOs doing it? And how are they working towards making cancer treatment more affordable and accessible to the patients? So you're on mute.
Thank you, Simran. I'd like to thank all the panelists for having made my job much easier. Like all of you have agreed that prevention is better than cure. So before I answer Simran's question of how NGOs spread awareness and what are we doing regarding low cost treatment availability to the common man, I'd like to tell you something about Indian Cancer Society. Indian Cancer Society is one of the largest and the oldest health NGOs of India. It was founded in Mumbai, that time Bombay, in the year 1951 with the stated objective of providing cancer awareness and education, as well as providing high quality, low cost cancer screening facilities. There are 7 branches pan India. I won't delve into that, but we have got a pan India visibility. Now, our mission is, like you already have said, prevention is better than cure. So, our mission is conquest of cancer by choice and not by chance, which implies that we go out into the public and give awareness about this dreaded disease and exhort people to come forward and get the screening done free of cost, which we are providing through the help of our CSR donors and other donors. So, now how we spread awareness, I will just cover that. We have got a awareness unit called as Jagrati. It is led by Mrs. Josna Govil, who is our chairperson in Delhi branch. I'll restrict myself to Delhi as of now. And we have got a lot of like-minded volunteers who go out in the community, in the schools, colleges, jugis, jhopadis, societies, underprivileged people, and talk about this disease. We carry a lot of IEC material and spread them to the public. Like it is a known fact that smoking causes head and neck cancer. Chewing chewing tobacco is the main root cause, which we have seen personally in villages where smoking is less and chewing tobacco is much more. So that is another thing which is specific to India and especially the rural areas. Then we have got regular radio talks on FM radio. You can hear us on Friday, Delhi branch on FM radio Rainbow 102.6, where we spend 10 minutes talking about the common cancers, especially the cancers which are for that month. Like you all would be knowing, and the public, those who are listening, would be knowing, every month is dedicated to some sort of a cancer. Besides the radio talk, we invite specialist doctors, oncologists to come on board and have panel discussions like we are having now. We started this concept of virtual meetings during Corona and we go about it regularly now, and it's become one of the new methods of spreading awareness. Then we have recently launched an e learning course. This is as per the new education policy of the government of India, and it's on a SWAYAM platform of Ministry of Human Resource Development. Anybody can join that and learn about the fundamentals of cancer. And if required, they can pay a very small amount, 1500 rupees, and appear for a certification course. And you will be happy to know that we have got over 15,500 people registered for this e-learning SWAYAM platform course. Then we recently in 2020 we started something known as faculty development program. It's a very interesting program. Again, under the new education policy, we train faculty members of universities and colleges. Say, for example, 5 per university or college, pan India, and they in turn will train their group of 5 to 10 students. So this way, our aim of spreading awareness is multiplied by this effort of a trainer of trainer being trained and then they imparting training to their own students, and that professor student relationship is very good. They learn much more than what we would like to explain to them. They learn much better from their own teachers. So this is about the faculty development program. Now, coming to another awareness big step which we have taken is we have launched a mobile app this World Cancer Day in February, known as Rise Against Cancer. It's a multilingual app in 5 languages. We'll be making it in other languages also. And it's on iOS. It's not on iOS as yet, but on Android it has been launched. iOS, it would be there very shortly. So from this app, one can learn about various type of cancers, their symptoms, their treatment, financial implications, legal implications, social implications, everything. There are a lot of podcasts on that. There are a lot of videos, short videos of 2 3 minutes, which the new generation, they don't have more capacity beyond 2 3 minutes to listen. So short videos have been made by doctors of Rajiv Gandhi Cancer Institute and other hospitals, which help people to know about this dreaded disease and if they get, what they should do. It has got a resource directory also, which includes list of doctors and places where they can go for their treatment and screening also. So we also provide free screening facilities. Since it's not a direct question, but just for information of everybody, we provide free screening facilities of the common cancers. We have got mobile vans. We have got set of 4 doctors who go to various places and do free cancer screening. Again, like I told you, finances provided by the CSR and other donors. Again, now I'll request the doctors. We have started a medical empowerment program. Like everybody knows, the first point of contact is a family doctor or a general practitioner who will keep on treating their patients without actually knowing about cervical cancer symptoms and when they should refer their patients to a specialist. Like everybody agreed, all the panelists said that on occurring of symptoms, they should come to an oncologist, but they don't come directly. There is a family doctor involved. This concept of family doctors are dying very fast. This is what we want to revive through this through this medical empowerment programs. We have recently done in Delhi. We have been doing in Mumbai, wherein we get the GPs, we get the oncologist in face to face, we get nurses also, paramedic staff, and then it's explained at what stage they should refer their patients to a higher tertiary hospital or, for that matter, for specialist opinion. This was regarding raising of awareness. So, like I told you, we have got mobile app, we have got radio talks, we have got face-to-face programs, e-learning programs. So this all leads to increased awareness of cancers. Now, how are NGOs and CSOs helping in making the treatment affordable? Actually, we don't have that capacity to make it affordable. It is more doctors and the pharma companies which would be capable of, or which are entitled, or what should I say, can make the treatment cheaper. But however, we do advocacy on this. We are on the panel of tobacco subcommittee of the Parliament of India, wherein we are called time to time for having discussions. So we tell them over there that why not include more medicines, cancer specialist medicines, in under PMJ, Pradhan Mantri Jan Arogya Yojana. That is also, by the way, undergoing a change. There are a lot of people, those who have been giving inputs that it should be like this, it should be like that. Even we have given our points, what all it should include. And the ceiling, monetary ceiling should be raised from 5 lakhs to 10 lakhs, things like that. So we are the patient's voice, and I'm happy that in India now patients' voice are being heard. Of course, population is so much, poor patient, and I feel bad for the doctors also. They want to help, but see the crowd in front of AIMS, in front of Safdarjung government hospital. So humanly impossible for doctors to take proper care, or I shouldn't say proper care, to give full attention to each and every patient. So responsibility lies more with pharma companies and the doctors as to how to make the treatment more affordable. But yes, we put in our bit and our efforts. to advocate to the government as to what should be. We say, okay, at least these important medicines, इस पे GST माफ कर दो. So it will become, because GST burden also comes onto the patient. So this is how we go about our task. So I was more specific, and limitation of time is there. So I'll end my talk over here. And it was in fact fantastic. Simran, thank you for having called me and allowed me to be a speaker on this panel.
Thank you so much, sir, for sharing how in depth, aggressively Indian Cancer Society is doing for the cancer awareness or to provide any kind of relief to the patients and to the family. The society is doing a great work in this and in its full capacity. We are happy to have you with us on a platform, and thank you for sharing all these details with us. As you said, we are short of time, so I would just quickly ask all my guests to, my to answer my last question very briefly. My question would be to Dr. Prasad. So, what is the commonly prescribed chemotherapy, targeted therapy, and immunotherapy medication for treating head and neck cancer, and how does the treatment impact the patient's quality of life?
Yeah. So we do have different medications. For example, cisplatin, which is quite a cheap drug. Not would cost more than about say around 300 to 500 rupees for the course of one single cycle of chemotherapy. Is a very effective drug which can be used in head and neck cancer and has not been replaced by any drug for the past 30 years at least. But cisplatin alone is not sufficient, and it is not like the final drug. Researchers had happened, a lot of newer drugs had come in. There are newer chemotherapy drugs which have been manufactured by the nanotechnology forms. So all these in tandem with this cisplatin had been used as a doublet chemotherapy regimen, which had changed the way we treat head and neck cancers. The second thing would be targeted therapy. So at least we do have a couple of targeted therapies which can be used in head and neck cancers. There are different medications. Somebody who's old, somebody has kidney problems, say for somebody has some other problems because of which they won't be able to tolerate cisplatin. Then we could use all these newer targeted therapy medications in replacement of cisplatin, and probably can have a better outcomes instead of just having the surgical or the radiation treatments alone. The third thing is the new kid on the block, which is the immunotherapy, which is probably the game changer. There are a lot of newer studies. Doctors, scientists are trying to understand our immune system more compared to what it was few years ago or a decade ago. We never had any immunotherapy drug. We didn't have any major breakthrough in immunotherapy drug, but at least now we have two drugs. Unfortunately, we do have to respect the world business laws, patency period. So, because of that, still the innovator medications are quite expensive. Cost is very prohibitive for a common man. But fortunately, with the newer ordinances, drug price control, and the NPPA, the prices have been sealed. So there are numerous changes which is probably expected because of the government initiatives for controlling the prices and making the cancer treatment affordable. Colonel Tomar had clearly said it's not just only with the doctors, it's mainly with the government who has the ultimate whip. I would obviously say it as a whip
I agree, sir.
because
I agree.
because end of the day, the citizens should be the beneficiaries. Citizens should be having access to all the newer treatments, be it somebody from Kashmir or capital or Kanyakumari or any place, even from a village in India. That person should have the same treatment option available like somebody who is from any of the capital cities. So resources has to be equally distributed. Colonel Tomar was saying the crowd which is in front of AIMS and Safdarjung. Why? If the facilities are distributed, resources are equally distributed in, say, UP or in Bihar or in tier 2, tier 3 cities, the problem is the development happens only in tier 1 cities, only in the capitals. It has
That's
to
right.
happen equally everywhere so that everybody is having access. I cannot come and stay in Delhi for 1 month. I don't know Hindi. I don't know what to where to stay. I don't know which doctor to meet with. But if the same treatment which can be available in AIMS is available in Chennai, at least in a tier 2 or a tier 3 city, why would anybody go to Delhi? Why would anybody wait in front of AIMS and substance right from the early morning to get that OPD token? So the crowd, when it comes down, quality care, accessible care, and the best care can be provided by all the doctors to all our patients. Here, it clearly said it's humanly not possible. Unfortunately, doctors are also humans. So we should also be getting the proper time to spend with each and every patient. Anybody coming to the government hospital should be treated the same way like anybody going to a private hospital. The time is the essence. Making the drugs affordable. Second thing, distributing the resources helps everybody get the best treatment. And when everything is available to everybody, I'm sure we'll be able to give a proper care to the patient's treatment. We'll be able to deal with more of early stage diseases. For example, when I was a student 2 decades ago, if somebody comes with head and neck cancer, the waiting list is so much that the radiation waiting list date is given after 2 months.
Oh,
I don't think cancer will be waiting for 2 months just for the doctors to start with the treatment. Absolutely not. We would have early stage recorded in the case file, but the patient when they come after 2 months, it will be a different stage. Everything gets changed. But at least now, at least in Chennai, at least in Tamil Nadu, where the linear accelerator was available only in Chennai 20 years ago. But now, because of the government initiation, linear accelerators are available in more than 14 districts in major cities. Every 100 kilometers have one linear accelerator. Thanks to the central government, thanks to the state government, thanks to all the people involved in getting the funds for the state. End of the day, government is ready to help. There are ways and means. There are people who are ready to help the patients. The only thing is we need to approach the right patient for getting, I mean, right person to get the resources done in the second tier and the tier 3 cities. Quality of life can be made much more good, better, and only when we treat the patients at a very early stage. When patients are caught or diagnosed in a very early stage, then probably the quality of life cure rates are all good. So now for the next 10 years, we need to concentrate more on the prevention. 80% has to be on the prevention, 20% has to be on the treatment, so that in the
yes.
next 10 to 15 years, we would not have many head and neck cancers. The change had happened in cervical cancer. In cervical cancer, when I was a student, most of the patients coming to the government hospitals will be having only cervical cancer. But now I just went for a small lecture to my alumni. The incidence of cervical cancer has come down a lot thanks to the government initiative. Prevention is the way forward. We should not have too many cancer patients coming to the hospital, but too many general population coming to the hospital for screening.
Hmm.
That's the new India that we are looking for.
Yes.
Said it right. So prevention is always better than cure, and the new India is always about coming for the screening and not for the treatment. That's how we are creating the awareness through one of the panel discussions which we are having right now. That's what our aim to. Quickly, my last question would be to Dr. Chaudhary. So, can you please give me the survival rates for the head and neck cancer patients, and what precautions should patients take during and after treatment of head and neck cancer? So you're on mute.
Thank you,
Yes.
Simran, once again. And a special thank to Dr. Colonel Tomar, Ajay Tomar, for sharing the insights for ICS. Dr. E. Prasad has rightly summarized all the things that every stakeholder need to be participate for the prevention and the treatment part. And we should more and more focus on the early diagnosis and the prevention rather than treatment part. Definitely, treatment is important also, and new drugs are important. But what is more important is prevention, because since last 15 or 20 years we came into the practice, we are seeing more and more patients rather than decreasing number of the patients number are increasing. This is really troublesome, and this is not a good sign. And for that, we need a political willpower along with the other stakeholders. Also, contribution is required. Coming to the results and the outcomes about the head and neck cancer, that has improved a lot. And if we have the data from the Western world, where we talk about the 5 year survivals, which is around 60% for all the head and neck cancers, which is good. And it largely depend on the stage of the cancer at the time of the diagnosis, the place where the patient got the treatment, right treatment. Because nowadays cancer treatment are done by the multidisciplinary team. So every medical oncologist, surgical oncologist, and the radiation oncologist and interventional radiologists, psycho counselors, they are required to present during the discussion, because the patient's motivation, social support, they also influence the outcomes apart from the stage and the treatment. So depending on the stage and the place where they are getting the treatment, if that is stage 1, then 5 year survival has more than 85%. And it decreased to around 40% if that is stage 4. So what we need, that need of the time or the need of the hour, is early diagnosis, prevention, screening, and more and awareness. And Simran, you are doing the right things. I think awareness is required. And thank you all the panelists also from my end also, and Simran, for the such a beautiful discussion. Thank you.
Thank you so much, sir, for sharing your insights and great expertise with us. Without the speakers and the panelists, it won't be possible for us to create this kind of awareness, which we are doing this together. And Colonel Ajay, sir, I have the last question, and I would ask you to sum up this session for us. We know that this community and general public can also contribute in support for the head and neck cancer patient for raising this awareness about the disease. But I want to know how we, a common janta, common insan, can do this for society.
Sorry, can you just common janta can do what for the society?
For raising the
Awareness?
awareness for head and neck cancer
Oh, yeah.
patients.
Yeah, yeah. See, it is a chain reaction. One person to another, another to other. Like screen the mother, vaccinate the daughter. People coming for screening, भैया अपनी बेटी को भी vaccination करा लो. Like अपना sir has said that cervical cancer results were so good, and it is through awareness and government initiative, of course. But common man has to speak, and once we go, we all our screenings are preceded by awareness talks. So the people those who have come for screening, they in turn go and tell others कि भाई ऐसे ऐसे हो रहा है, and knowledge has to be shared. Then only it's knowledge. Otherwise, it's just information with you. So I think that is what is required. And universal health coverage is absolutely a must. Like Dr. Choudhary and Dr. Prasad, they were saying that we want to see more people coming for screening rather than coming as patients. That is possible only once you have universal health coverage. चाहे रंग हो चाहे राजा हो, all over India, everybody should be treated the same. Thank you.
Thank you so much, sir. Thank you so much for summing up the session and giving your advice on how every person in this country, can help us reduce the risk of head and neck cancer patient and raising awareness. And I would like to thank all my panelists for coming up for the session, sharing your expertise and insights with us, shedding light on the various aspects of head and neck cancer and how we can treat it, diagnosis, after treatment stuff, the counseling stuff, and how we all as a society can prevent this. And I think together we all are doing great work, coming here talking about it. It's a collective action we are taking, and thank you so much for giving us your time and coming to our platform.
So thank you so much, Simran, and thanks a lot for the team. Dhanyawad.
Thank you so much. Thanks.
Right, thank you.